speak today in support of this bill, the Saving Today's Acute Care Resources Act, legislation that I was proud to co-lead with Mr. Hearn. Mr. Hearn has already talked about the vital role that the LTACs have in our healthcare hospital system. They care for some of Medicaid's sickest patients, and these are individuals who often need extended hospital care after a serious illness or injury. And by transferring patients to the long-term care hospitals where they receive the care they really need at that point in their illness or injury, it also, an additional benefit, it frees up what are often scarce beds in the acute care hospital. So they're really important for a number of reasons. But unfortunately, again, as Mr. Hearn described, the Medicare payment rules at times have created what I think are unnecessary barriers that can delay the right care, delay the transfer to the LTAC for the patient who needs that care. Today, some seniors with medical complexities are required to remain in an intensive care unit or be transferred between other hospitals simply to satisfy reimbursement requirements, not because of what's best for that particular patient at that time. And so this bill provides a common sense solution to that problem. It creates a new pathway so that these patients, the sickest patients, can access long-term care hospitals without unnecessary delays. And it allows eligible patients treated at critical access hospitals in rural communities to transfer directly to an LTAC hospital instead of making unnecessary steps along the way. So it's not about expanding bureaucracy. It's not about creating a new entitlement. It's simply about removing outdated government barriers that stand between seniors and the appropriate care that they need and deserve. Helps patients receive treatment in the most appropriate setting, frees up hospital capacity I mentioned, and supports providers that care for our most medically complex patients, including these long-term care hospitals that serve communities across my district and, of course, in many others. So I want to thank Congressman Hearn. Also, Congressman Miller has been an important part of the work on this legislation, and I urge my colleagues to support this act. Thank you, Mr. Chairman.